Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please leave your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. I hope this will be very convenient for your continuous study. Thank you very much. Now course. Okay. Now usually dengue fever will run in three important courses. Okay, number one is febrile phase, second is critical phase, and third one is recovery phase. So there are mainly three phases in the dengue fever. So what do you mean by febrile phase? Febrile phase means first there is a fever, first phase of the fever. That means from the day one this fever starts and this may continue up to 7 days. So child is having fever, along with that fever will be there for the first 7 days or 6 days, maybe in between 5 days also. Okay, so this phase is called as febrile phase. So what actually happens in this phase is there will be high fever. Okay, there will be moderate to high fever, and there may be some erythematous skin rashes if it is a symptomatic case. Asymptomatic conditions, okay, only fever is there, nothing is happening. Okay, so erythematous skin rash may be there, child is having body ache, myalgia, arthralgia and headache, etc. Okay, so in this phase what happens, there may be some very mild hemorrhagic manifestations, like petechiae, and there may be tender hepatomegaly or leukopenia, etc. So this is if a dengue fever case comes under the category of symptomatic in the sense fever with complications. If there is fever without any complications, even you will not get all these symptoms. Okay, and we know that more than 80% of the cases, 50 to 80% of the cases are asymptomatic in the sense, just like other viruses, fever will be there without any complications. But here, if it is a symptomatic phase, then this is the first phase. If it is a symptomatic case, in that case the first phase is febrile phase. That febrile phase is not only simply with the fever, along with the fever it will have some other manifestations like myalgia, body ache, headache, then some mild bleeding manifestations on tourniquet test, etc., along with tender hepatomegaly and leukopenia. Now, okay, so once this phase is over, then starts the phase of critical phase. Now this is a very important phase. If it is a symptomatic case of a dengue fever. Now this will go into last for 2 to 3 days or sometimes 1 to 2 days. Okay. Now this is a very interesting phase here where the fever comes down. So naturally what happens is when fever comes down, everybody will get relaxed, including patient and physician. Everybody will go into relax because fever coming down. But fever is coming down, but it is a dangerous sign here. Therefore it is called as biphasic nature, saddleback fever, biphasic nature. So in this time the fever will come down. We will call it as the period of defervescence. And fever is coming down, but there will be progressive leukopenia and thrombocytopenia. Fever is coming down, but if you see the platelet count and CBC, leukopenia is coming down dangerously. And thrombocytopenia is also coming down. That means platelet is also coming down. That means blood is leaking out of the vessel into the extravascular space, along with so many proteins, along with the WBCs, along with the platelets and along with the RBC. So therefore we are having leukopenia and thrombocytopenia and also raising hematocrit value. So now the fluid is coming out into the extravascular space. Where it goes? It goes to the pleura, pericardium, third space, okay, peritoneum, etc. So as I told earlier, as a result of this what happens? There is raise in the hematocrit value because RBC concentration is now decreasing in the blood. RBC concentration is decreasing. Therefore hematocrit value will increase. Okay, so now both plasma and the RBC are also leaking out. In that case there will be decrease in the hematocrit. If hematocrit raised means blood, that means RBC also start leaking out, and it is dangerously leaking if it is daily increasing. Now what actually happens in between these 2 or 3 days? our primary job to find out the complications of the dengue, isn't it? So we must identify that does the child has simple dengue fever or dengue hemorrhagic fever. So remember, children with a simple dengue fever will have the thrombocytopenia but will not have the capillary leaking in the first phase. Okay, simple fever, there only thrombocytopenia is taking place. That thrombocytopenia may be because of the antibodies which is produced against the platelets also. Okay, so fever will have the thrombocytopenia but will not have the capillary leaking. Hence, it will not progress to a shock-like condition. And they may develop encephalitis, myocarditis, but they never end with the shock. But in a dengue hemorrhagic fever, in a critical phase, if it is there, there will be capillary leak and more blood is going out, fluid is going out, and they find their own way in the extracellular space and they reach as the third space. There may be pleural effusion, pericardial effusion, peritoneal ascites. Okay, it leads to so many warning signs because of the compression and all that. So all these signs indicate that child is started leaking. Now, in the critical phase, there will be abdominal pain and tenderness due to collection of the fluid in the retroperitoneal space, isn't it? And perirenal area. 90% sensitive sign. Now, why we are taking that, always telling that abdominal pain is a warning sign, abdominal pain is a warning sign. The reason is when the fluid collect in the peritoneal cavity, it put the compression. It put the compression over the abdomen and abdominal organs that leads to pain. Similarly, retroperitoneal space fluid collection will be there that leads to pain over the kidney. So you will have perirenal area or renal angle pain, that renal angle area, there also you will have fullness and pain. Look for the ascites and the pleural effusion. If the pleural effusion is there, child may develop the breathing difficulties. Persistent vomiting may be there. That is also because of the compression of the intestine and abdominal cavity by the collected fluid. Okay. Then mucosal bleeding will be there. Maybe from the gums, maybe from the nose. Okay. Maybe from the other mucosal areas of the body. Mucosal bleeding now starts. Okay. Bleeding will start because one is capillary leakage, but platelet is also coming down. Okay, either platelet is leaking out or there is production of some antibodies against the platelet. So totally platelet count drastically come down. So that may lead to mucosal bleeding. Now, when such an amount of blood and fluids get lost from the body, definitely you will have lethargy and restlessness. Okay, because of the leakage. So liver is also enlarged because of the congestion, more than 2 centimeter, and progressive increase in the hematocrit value will be always seen. I hope you understood this critical phase. So this is what actually happens in the critical phase. So when fever comes down, you are suspecting a case of dengue. Fortunately, fever comes down by 6th day. Patient is happy, but doctor should not be happy. You have to watch and tell the patient also to be careful, because when the fever comes down in the second phase, critical phase, all the complications starts. Okay, if the fever comes down, there is no any complication, well and good. Educate the patient clearly. If you develop all these symptoms, immediately come to me. Immediately you have to come for the follow-up. And if the symptoms are not developed, warning signs are not developing, no problem. You are also happy, I am also happy. Now come to the last phase, that is recovery phase. So what is this recovery phase? So after the completion of the critical phase, for the next 2 or 3 days, it is called as a recovery phase. So what is recovery phase? Now the dengue virus infection has reduced, capillary damage is not taking place no more, there is no any antibodies against the platelets. Now the things return back to normal gradually. Okay, the fluid which is entered into the extracellular space now start coming back inside. So when the fluid start coming inside the vessel again, what happens? The edema reduces, compression reduces. In the GIT also edema reduces. The metabolism starts, digestion starts, metabolism starts. Now patient starts recovering. This leads to improvement in the appetite and general well-being of the child. Now this is a recovery phase. But if the critical phase is not managed very well, okay, then there may not be any recovery phase. Then we have to treat the shock conditions, hemorrhagic shock conditions. Okay, so everything is happening in those symptomatic cases. Luckily 50 to 80% will not have all symptoms at all. although dengue is positive for them. NSG, that test if shows positive sensitivity also, they may not have any symptoms. But if it is symptomatic dengue, then all these three phases will be there. Rest of the things we will continue in the next class regarding classification, how we have to handle mild, moderate and severe cases. Thank you very much.